I'd like to invite our next speaker, Harriet Nankya. Harriet, there you are. Hi, come up. Harriet is from Makerere University in Uganda, and she will speak to us about the regulation of health data in her country. So, warm welcome, please, to Harriet.
Thank you so much. Good morning, everyone. My name is Harriet Nankya. I'm a PhD student of Bioethics from Makerere University, Uganda, and I'm presenting regulation of health data for artificial intelligence in Uganda. So this paper is an assessment of the Ugandan regulation of health data in reference to the World Health Organization's recommendations for health data protection in development of artificial intelligence. So it's more like a comparison, okay, not like a comparison, but a confirmation to what WHO recommends and how we stand in our country. So there is much that artificial intelligence is promising in health and improving healthcare, maybe providing faster and more accurate diagnosis, treatment and management of disease. And it's also helping in data, like analyzing of big data, maybe in aspects like genomics and management of health delivery, like it's trying to lend a hand to human resource in trying to manage diseases. And also issues of public health, where it's being used a lot in maybe like pandemics. So it is a lot that artificial intelligence is promising. However, there are ethical issues that also pertain to it. And for us to be able to appreciate the benefits of artificial intelligence, we have to address the ethical issues that pertain to it. Issues to do with autonomy and the loss of control of data by the people who give in their data. Issues of cyber security, accountability, who's accountable in form of anything. Is it a machine or the people who made the machine or the person using it? So all those issues, also issues with bias, especially in the development of the algorithms. So all those issues need to be addressed for us to be able to appreciate the benefits of artificial intelligence. So this calls for us to prioritize a lot the ethical principles and human rights in the development and application of artificial intelligence. Because for it to be effective, the bias is mainly encoded in the data algorithm training and validation have to be overcome. Data is an important aspect in artificial intelligence because it informs the development, training and validation of the algorithmic models to use. However, also data is suffering issues in its management. Also the quality of data is affected by underrepresentation maybe of some groups like according to gender, age, and also the possibility of repurposing of this data for uses that they were not intended for in the collection of such data. Then issues of control data like loss of consent and autonomy and privacy that may stigmatize people that are maybe vulnerable or undermine the dignity and the human rights of those individuals who give in their data, or even the agency, the control of them to their data. So this calls for regulation of such data, especially in the development and implementation of artificial intelligence. And if we have good regulation, then we shall be able to achieve compliance and public trust in artificial intelligence generally. However, where do we stand in terms of regulation? Currently, there are gaps in the regulation, especially in aspects of the ethical and legal perspectives. And in Uganda, currently, there's scant well-defined regulations for research specifically for artificial intelligence. However, how do we move forward? We need to put consideration on these aspects into consideration. First is the human rights, then the data protection laws and ethical principles. All those three have to come in place to guide, regulate, and manage the use of artificial intelligence. And there should be regulatory authorities like in the protection and regulation of data, there should be authority in different countries to, first of all, develop these guidelines and regulations and provide guidance on how they should be achieved and followed, and also conduct investigations mainly to see compliance, people's compliance to such regulations. So WHO, in that regard, has a group that is responsible for regulation of artificial intelligence, and it has examined how and put up new considerations of how artificial intelligence should be regulated. In a report by WHO that was published last year on ethics and governance of AI for health, considerations and recommendations were made that can act as reference for governments to develop their own laws to ensure appropriate protection, regulation, and safeguard of artificial intelligence. And these are mainly focused on strengthening ethical norms and standards, and they would also help in building trust of the people, especially the public, that are involved in development and implementation of artificial intelligence. So this paper mainly is describing how Uganda is positioned to conform to those recommendations by WHO. Where do we stand? What does WHO recommend? And how has Uganda tried to fit into those recommendations? So we appreciate WHO because it's informed by a number of, those recommendations by WHO are informed by a number of experts and countries and guidelines, and they inform universal health coverage, so they can be based on as a guide for us in Uganda to also strengthen our regulation of artificial intelligence. So there are a number of recommendations, but this paper mainly focused on those that pertain to data protection. And one of the recommendations is government should have clear data protection laws and regulations, and also strengthen rights to meaningful informed consent by people who give in their data. So in that aspect, Uganda has a Data Protection and Privacy Act that was enacted in 2019, and it's in line with the Constitution of Uganda's Article 27 that requires protection of privacy of individuals. So we have the Act, then we have the Data Protection and Privacy Regulations that came in 2021, and the Act and the regulation purposely support the protection of privacy and personal data, and they do that for all the stages of data from collection to processing, storage, and even sharing, and whatever step may be required. So the Act and the regulation were informed by some international conventions, like the UK Data Protection Act, the Universal Declaration of Human Rights, to which Uganda is a signatory, then the European Union General Data Protection Regulations, and also there are some regulations in Africa, like the African Continent Cyber Security and Data Protection Act. Yeah, so the second recommendation requires governments having an independent data protection authority to enforce the regulations that are already in place. So in that line, Uganda has the Personal Data Protection Office, which we shall call the office, and it's like the National Data Protection Authority that oversees the implementation and enforcement of the Act and the regulation. So it's an independent body that doesn't depend on other authorities for its to do its work. And in Section 6 of the regulation, the office can cooperate with other bodies like ministries, departments, and agencies. And in that line, it can work along with the Uganda National Drug Authority, especially if maybe the artificial intelligence is intended to develop a drug or a vaccine. There, other bodies have to come in to work along with the office. And also it can work with the Uganda National Council for Science and Technology. And this is an agency that is responsible for ethical oversight of research involving humans. So you see the ethical aspect also coming into the law and the regulation. So the third recommendation is that government should require entities to seek to use health data to be transparent about the scope and the intended use of such data. So in this aspect, Section 12 of the Act emphasizes that the lawful use of data. The data should be used for purposes that are lawful and not illegal, and the purpose should be specific, explicit, and also related to the function of the data collector. If it's artificial intelligence, then the organization that is collecting such data should be really using it for artificial intelligence and should be registered to do that particular kind of job. So data should be entrusted to a body that can handle it appropriately. Then section 17 allows further processing of data. Yes, data can be used for further purposes. However, the purpose should be specific and should be in the benefit of the public. For example, it can be for forensic purposes, for research, maybe statistics, and maybe historical. So for such purposes, there can be allowance for further processing of data. So this requirement for data transparency helps to reduce the possibility of repurposing of data. If data is collected for a specific purpose, then the chances of it being misused, maybe for commercial, unintended for uses, is limited, so that we avoid any ethical, legal, and human rights concerns that may come along with it. So recommendation 4 requires community oversight of data. However, the Act does not stipulate community oversight. The Act is mainly focusing on personal data protection, like individual. So aspects of group oversight, for example, community oversight are lacking. However, even in absence of regulations, data handlers are called upon to work with integrity and respect the rights of the people who donate the data. Recommendation 5 requires data hubs to meet the highest standard of informed consent, be transparent, and also, in case of any outcomes, those should be of public benefit. So you find that neither the Act nor the regulation stipulates any data handling by data hubs, but informed consent should still be strengthened as is required in Section 34 of the regulations. Consent to data collection, processing, and control is still paramount. And without consent, if you use data without consent, you stand to commit an offense that is punishable. The recommendation 6 requires impact assessment of artificial intelligence. And one of the aspects to assess is safety and data protection. So Section 12 of the regulations requires every data impact assessment of data, which requires predicting the process, what you predict the data to be, any possible risks you foresee, and any measures in place to address such issues, and also being liable to any other requirements in the impact assessment that the office may have. In this aspect, the office also has a responsibility of making public a list of processing operations that are subject to requirements of a data protection impact assessment. Then the last recommendation is on adopting models of co-regulation with the private sector. So like I said, the office does not work alone. In Section 6 of the regulation, the office is given power to cooperate with other authorities, like I earlier listed, for example, departments, agencies, and ministries. And these are all responsible to accord to the office such assistance that may be necessary to ensure a proper discharge of its functions. So in conclusion, you see that principally the rules and principles of the Act and regulation try to strengthen at least the rights of the individuals who give in their data, and also stipulate obligations of the data collectors. So this could help in shaping the way artificial intelligence should be developed. However, there's still gap, especially in safeguarding information for the purpose of artificial intelligence, because of the fact that artificial intelligence is handling big data. You find that the traditional data processing laws and principles may not be in position to address all the possible issues that may come along. So these are the papers that informed my work, and I would like to appreciate the advice I got from Effie and Adrian. Thank you so much.
You can come over over here, so you're not on the spot like that. And we can take questions for Harriet's paper. I see one question over here, yeah.
Thanks for your presentation. A short question regarding recommendation number 7. To what extent do you really think that donor of the data is able to request that his data is removed? Because most of the AI collection of data is done anonymously.
All right, thank you. I think that is a challenge, actually. I think I raised that in our group discussion of yesterday. I feel there's, participants have a right to withdraw their consent or put a limitation to how far their data should be used. However, in cases of anonymization, it's hard to trace back to see that this person is the one, this data belongs to this kind of person. So I feel there's that limitation, which I think we need to find a way of handling.
Yeah, I mean, I think that's something, again, not so new to AI, right? If we anonymize data before, people should understand that, if you anonymize, it's kind of hard to withdraw, so to go and find the data. So I think I'm not sure that's so much different in this context, but it is something we've been dealing with, and it's a matter of also understanding what it means. One of the things we've seen in some of our work is that people want both. Often, if you ask them, and they prefer uses of their anonymized data, and they also want to have the right to withdraw. And we have to understand that that some of those things are not possible in combination, and you have to make some choice, right? Yeah. There was one more question. Yeah, continue.
Hey, so my question is mostly for Harriet. So we spoke a little bit yesterday, I think, over the sessions about this idea of data sovereignty and striking a balance between, I guess, protection and collaboration or and so on and so forth. And I wondered, in the light of these two pieces of legislation and based on your experience, I mean, how is that balance being struck by the regulatory authorities in Uganda? So, I mean, are people... Yeah, I'm just curious about this kind of balance between fostering research and innovation in these spaces, including the export of data to foster these kinds of innovations versus protection to prevent exploitation and so on and so forth.
I don't know if I'm even getting the question. Sorry. Could you repeat?
Okay. So we know from H3 Africa, for instance, that regulatory authorities across the continent are constantly having to strike this balance between fostering scientific collaboration and innovation, which often requires the export of data, and protecting against exploitation or protecting the scientific agency of countries themselves. And so I wondered, with these two pieces of legislation that you speak about, how are the regulatory authorities in Uganda striking that balance? Is that clearer?
Yeah, it is. Actually, from what I know, it's more about consenting. Even if you need to export the data, the person giving you the data should be in the know of how you're going to use it, how far it's going, and maybe for how long you're going to keep it. And then they have to consent to that. However, I still feel consenting is not protecting enough. There could still be a gap, and how do you actually control, especially if that has gone too far? However, I think one of the international guidelines recommended that if data is anonymized, because we don't want to limit research because we want to protect so much the participant, there's still that struggle between protection and then having science progress. So what the recommendations require is anonymization. If you can detach the identity from the individual, possibly there could be a chance of that data going as far as it may go. But still the challenge with that is the achievement of 100% anonymization. That is still a challenge. And also if we anonymize completely, won't we be somehow blocking the scientific benefits the individual may gain from their data if you detach them completely from it? So I think it's still a challenge, but what is standing currently is strengthening consenting and being very open to what the data is going to be used. Yeah, thank you.
Thank you. More questions. We can open the floor to just general discussion. Yes, I see many people in the back. Okay.
Thank you. This is really interesting work on data protections. I wonder, given the focus of these two presentations on the role of regulators on protections, is there also a role for regulators to be looking at the quality, quantity, and representativeness of the data and setting some sort of a floor, given what we know about bias in terms of the learning environment applications of AI? And what do you see as the role of regulators in that space before they even have the data and are thinking about transferring in who has access?
Any of you would like to? Yeah. So, Carly, I think we did have a bit of a sound issue back here. Could you repeat more or come forward? We couldn't hear it clearly. I think I caught some of it, but not all of it as well.
Sorry, yeah, it was just a question of beyond the role of regulators in ensuring data protection, do you see a role for regulators in ensuring the quality, quantity, and representativeness of the data that would then be used, or setting sort of a minimum requirement for the data before it's used in an AI application?
Actually, I think what the main issue that is bringing in the bias in the quality of data is underrepresentation. I think this was another topic of discussion we had yesterday in the breakout rooms. I don't know if I'll get a report on that from the different groups, but it's some big issue that is still under discussion. I don't know if you shall get feedback from the different groups, because we didn't include on it in my group, I think.
Thank you. I'm not sure, Carla, that I'm just if I may add a thought here. Would we want the regulator to be going down to that nitty-grittiness of stuff? I mean, we do have the data protection regulation, which, you know, we do have in many places the Human Research Act. That's another piece. We have institutional review boards, data access committees. There are many pieces that I think could possibly take on the role we know were keen to be taken on by somebody. I'm just wondering how would it be if we have sort of like very specificity at the sort of, you know, legal level about that, or whether that's something that should be given more, should be achieved via the institutions we already maybe have in place. I mean, I'm just thinking out loud as well in terms of how we would want to get to that.
Yeah, I mean, I think it's a real question on which actors and which pieces of legal instruments might, you know, set minimum standards, and then how that plays out through those different institutions. I mean, I know, you know, the States is probably the one I'm the most familiar with, but, you know, regulations set the standards for if you have NIH funding, then you can't, you know, proceed with just sample of all men unless there's a really good justification, like it's a health condition that only affects men. So there are ways where you might be able to bake into the regulations, and then the institutions that carry out the assessment of what's being done carry that through their processes. But I guess it's just a question of what is the role for regulators in making sure that AI doesn't kind of go in places where there's just really poor data to start with, or where you would need an upfront investment in creating better data and addressing the data poverty and lack of representativeness before you'd even get to the stage of moving forward with your AI application. So it's an open question. It's just, what is that role and how do we think about that?
Just to add very quickly, I think it's important to start somewhere, and I also think that research ethics committees or IRBs would play an important role in this. We recently had a workshop in which we had a lot of regs or IRBs attend, and it was more focused on sort of training regarding research that involves big data and so on.
Yeah. Can I?
We have, yeah.
Now, this is just a question for Nazareth. With regard to, it's just a clarification, the choice of countries, you mentioned that, these are the research-intensive countries, South Africa, Nigeria, Kenya, Ethiopia, Uganda. I noticed that they are all English-speaking countries. Did your research embrace the non-English-speaking countries in Africa, since they have different sort of like legislative systems, or you're focusing only on the English-speaking countries?
Thank you for that question. So I firstly want to tell you where we got that information from. There is, I think it's called SciMago Journal and country rank. So these countries were ranked in order of research output by public health and environmental research. So initially, before we came to these 5 countries, we did look at many other sub-Saharan countries, and we actually faced quite a challenge because some countries, like Francophone countries and Lusophone countries, didn't have their legislation available in English, or sometimes it wasn't even accessible at all. So in order to we didn't want to, cause more issues for ourselves to take laws that were in another language and then try to interpret that and then back translate it. So we also stuck with the Anglophone countries for now, but this is also the early phase of our research. If we might later on get people to work with us to help us interpret the law in other languages. Could you please say that again?
I'm saying that do we not run the risk of falling into the previous question's discussion about bias in data if we're talking about research legislation across the continent and the data we're drawing from is mainly English language data?
I hear what you're saying. So we are starting small. So for now we have got these 5 countries that we are looking at, and we are planning to look at other countries, including Lusophone and Francophone countries, to avoid leaving countries out.
Thank you. We have more questions. Where? Yes. Over there? Yeah.
Yes, thank you for your presentation. I know that data lives a long time, even beyond the research, but my question is on the collaborating institutions. Do we have any way of tracing that data? Is it traceable across the collaborating institutions? For example, after 10 years and we want to know what happened at a certain point, are there SOPs guiding this kind of access, or other than the legal acts and the fact that there's no uniform law on this? Thank you.
So I think maybe that your question actually highlights the importance of having data transfer agreements. In our paper, we just highlighted the minimum requirements for data transfer agreements. So I think countries it would need to be developed according to the context of that country, but I think a DTA would sort of steer us in the right direction and sort of assist with what you are asking.
Yeah. I wanted to come back to what Carly was mentioning before. Maybe it doesn't have to do exactly with a legal with a law, or because I also feel that maybe it's needed some kind of control. For example, when you're going to implement this in public hospitals or in hospitals, not just speaking of research, but going a little bit beyond. And you may have, well, something that has poor data or is biased or is not so efficient, as we were seeing also yesterday in the meeting groups. So I was wondering, maybe it's not a legal thing, it is above the realm and the power of research ethics committees. So I was also worried and thinking that maybe there's some need for, maybe not for all AI, but for some of it, to have some kind of extra control. I was thinking a little bit, and I think when I was reading the background paper, that FDA was going to address some of this issue, and I think it is important, maybe having that kind of structure regarding what kind of data, patients, and well, I wanted to not ask your ideas, not regarding your own research, but generally, because I think it is a very good point, the one that Carly mentioned.
Yeah, actually, in going forward with the regulation, realize that ethics alone is not enough. Law alone is not enough. So we have to bring in the ethics and also emphasize the human rights. So if we have all those three aspects in place, I think it will be broader and it will have the legal aspect where whoever commits the offense can face legal repercussions, and also the regulation in terms of the research ethics committees and oversight of research using the ethical aspects, emphasizing the principles that are all in place. So it is not just a law, it should be law, ethics, and maybe human rights for now, and maybe others may join in later.
No? Okay. Maybe. Okay. No, maybe just as we are moving on to the next question, can I just flag a point here? Are we doing AI exceptionalism? Didn't we have the problem or representativeness of data in pre-AI phases of our lives, in drug development, in genomics? How did we deal with that? Probably not well, but can we just, as we're thinking about these important questions, maybe also keep in the back of our minds whether we're putting these kinds of analytics, because that's what it is really, right? If we're requiring a different standard, and we may very well want a different standard, but then we have to ask ourselves, why are we asking for a different standard here? Just keep that as we're progressing in the discussion and maybe in the next rooms. But Catherine, you had somebody else.
Catherine has Judy here with Adrian. Good morning, everyone. I actually have a question for you, a practical question. So I think late last year, Google released an app that you just needed to use your Android phone, take a picture of your skin, and you get a result, right? Unfortunately, this app did not have many black examples. These are known issues, and anyone in the world could use it. So how you highlighted your laws in Uganda, sort of your framework in Uganda, maybe, and I know this is maybe too long of an answer, but could you help us think of maybe your top 3 things about how you would govern an app like that? What if I got a wrong diagnosis? Or what if I wanted my data from Google? Or how would I sort of, let's say I got a late diagnosis and I needed to sue someone. Would anything, what you've proposed, help?
Okay, maybe something I didn't mention. Uganda collaborated with some other organization to come up with a digital platform that can be used by the whole, like anyone, through SMSs to raise your concern. So in case of such, maybe someone could write, sorry, I'm forgetting how it's termed, but you could send an SMS reporting your concern, so can be received, because that organization is working along with the office. The office is the data regulatory authority we have in Uganda. So if you raise such a concern, then it can be handled by the office. And remember, the office works in collaboration with other ministries or agencies, like the National Council that oversees research on what? Research that pertains to humans. Then there's the Uganda National Drug Authority. So if it's something to do with health and healthcare, possibly the National Drug Authority can advise the office on how to handle such an issue.
Just a follow-up is that this is an app that you could download. It's not, in fact, they write there, it's not a medical device, but this is just an app, just the way I downloaded Google Maps. I just want to put in, as we go to the discussion, that AI sometimes, the way it's deployed, it's in a gray zone, and really, like, how can you sue Google for giving you the wrong directions to come to Lord Charles today?
Yeah, that is where the challenge of accountability, I think, comes in, that I mentioned earlier. Who is responsible? Is it the person who made the innovation, or the person using it, or the machine itself? So I think that's still an issue.
Yeah. Hi. My question is for the panel and anyone's in the room. I always wonder if there's a clear-cut definition what is considered to be sensitive data. Is there, in legal point, is there a clear-cut of what is a sensitive data? So, and regarding the transfer of data between countries, is there clear agreement between countries what is a sensitive data? Is it name, race, culture, religion, is it case by case? That's my question.
I think our law does, POPIA does sort of define it, but I can't think of it on the top of my head now. Could I ask Prof. Moodley for, she knows the POPIA very well.
So the Protection of Personal Information Act in South Africa defines certain categories of information as special personal information. This includes biometric information, also includes other aspects like race, gender, age. The thing about sensitive information is that it's going to vary from one context to another. So if you take South Africa as a country with an apartheid past, race is an extremely sensitive piece of data. And we have difficulty often with our funders who require data by race, ethnicity. This is the NIH in particular. For every participant that is enrolled or recruited into a research study, we need to provide data on race, gender, age, ethnicity. And the categories that are used in the US are imposed on countries around the world. So, for example, in South Africa, our research ethics committees are very specific. If we are asking for sensitive information, if we are asking for race or gender, we need to have a good reason why our research question needs that information. And then if we take the imposed categories from other parts of the world, then all our research participants are classified as non-Hispanic in South Africa, where ethnicity is concerned. And we don't see the value of having that kind of data collection. Yet it is a requirement of some funders. So I think what is regarded as sensitive information will vary. Another important aspect is HIV status within South Africa and perhaps in other countries as well. There could be issues related to gender in countries where homosexuality is illegal. That would be regarded as sensitive information. Thanks.
Thank you, Catherine. So just to add to your question, Adli, I think GDPR also says political affiliation. So that's also under special category. But as what was said just now, it's really context specific. So when we did our study on the Thai-Myanmar border, people really don't like their marital status known. That's sensitive.
Thank you. My question goes to Nazrit. Also, Harriet can also maybe chip in. When we are speaking about artificial intelligence, and related laws, data protection, data sharing, it all depends also on the institutional status of artificial intelligence within the country, for instance, whether it is subsumed in the Ministry of Education, or in the Ministry of Health, or in the Ministry of Science and Technology, or standalone as an institute or as an agency, artificial intelligence agency. So, did your research look at with the institutional status of artificial intelligence, whether they are standalone or existing within the existing other institutions? Otherwise, my experience is that sometimes we are asked by, for instance, Western funders. It could be NIH, it could be NIHR from UK. They ask us to give us a link or a website to how the data sharing policy of the country. Then we have to knock into institutions and go and ask them to come up. Or sometimes there are cases in which we have done this, in which there are some even at the university level, in which we were forced to ask universities to develop and then provide that link in order to apply for funding and all that. So I'm just wondering if you have looked at that, how institutional status or institutional level of artificial intelligence in your research.
Okay. So, Harriet, maybe you can ask a specific one. So, could you, I think, Harriet,
we didn't get a question.
Can you please sum up your question about...
No, I'm just asking, do you, in each of these countries, in Uganda, in Nigeria, in Ethiopia, I know, but also in South Africa, is there such artificial intelligence institute or agency as a standalone institution? Or is it within some other institutions?
Not that I'm aware of. I don't have any other.
She doesn't know. Okay, for me, in Uganda, I think I would like to ask Dr. Jingo, is yours a standalone institution dealing with artificial intelligence?
Depend on. So, well, I don't know how you define standalone, but it's a part of Makerere University and follows the regulations of the university.
Do we have any other in the country, or is only that one? Because it's a department, right?
Yes.
It's a department.
It's a
under
center.
Makerere
Yes.
University.
Right.
Thank you.
Nigeria has a standalone agency for artificial intelligence. It's under the NITD, the National thing for Department of Data Technology, Data Development Agency. So there we have a standalone agency for AI and robotics.
I think there was a very good discussion, so thank you all very much for the discussion. And thanks to our speakers for their fantastic presentations and for responding to the questions.